Early cancer warning signs that you should not ignore. Did you know that almost 1,670 people die due to cancer daily? This counts for about 6 million deaths per year. Well, these insane figures speak about the deadliness of this disease. But sadly, a large number of people don't even know that about 35% of the early stage cancer patient can be cured completely. Hello viewers, welcome to A to Z Bodyform. In this video, we're going to cover the most common early cancer warning signs that you should not ignore. Number 10. Persistent fatigue that doesn't go away. Feeling tired and dizzy all day can have several causes, and it's normal. But if anyone experiences tiredness even after having a full, fresh sleep of more than 6 to 8 hours daily, but still feels tired, and especially if this process continues to happen for a longer period of time, like for weeks and months, this might be suspicious. In this case, you have to do a few checks. Check if you are sleeping at night properly in a comfy place in a comfy environment. Check if you are properly hydrated, and check if you are getting enough sleep of 8 hours daily. Check if your routine is stable. Not to create panic, but if all checks are okay and you're still miserably tired, run to the doctor. But still, cancer can be one possibility out of thousands. According to the American Cancer Society, unexplained fatigue could be an initial sign of leukemia. Number 9. Digestive traces. Digestive illnesses that last longer than normal despite being treated can be a signal of malignant metastasis tumor onset. For example, stomach pain or nausea. Stomach pains are normal and can refer to other diseases, but the chronic stabbing stomach pain that lasts for more than 15 days, combined with blood and pus secretions in the stool, despite being treated, can be a sign of pancreatic, liver, intestinal, or esophageal cancer. Bloating is quite common, but prolonged bloating followed by other cancer symptoms can be an indication of gastrointestinal or ovarian cancer. Number 8. Random burning pains. Many of the tumors start without pain, but some of them may have a burning pain sensation at the onset of malignancy in a certain body part. Pain in cancer commonly starts when the tumor compresses or infiltrates the nearby cells or body parts. The intensity of cancer pain depends upon the location and stage of the disease. According to a survey in the cancer wards of hospitals in New York City, half of the people diagnosed with malignant cancer were experiencing pain exactly at the tumor site. However, 25% of all patients had such intense burning pains that affected their sleep, mood, social relations, and other daily life activities. Recent biological advancements, interdisciplined with the latest technologies, have enabled the medical procedure to reduce cancer pains by 80% upon treatment. But nearly 50% of the cancer patients do not have access to such facilities, which is the only problem left with cancer now. Number 7. Fever that lasts longer than 2 weeks. Fever is the natural immune response of the body in case of any infection, illness, or foreign body invasion like viral and bacterial attacks. We all experience fever now and then, but a fever that lasts more than 2 weeks is suspicious. It is a common symptom of thousands of diseases, but in case of other correlated symptoms, you need to see a doctor. On a lighter note, a person ill with cancer will have a fever, but it is not sure that a person having a fever has cancer also. However, chronic fevers may be a warning sign of blood cancers like leukemia or lymphoma. A fever, along with night sweats, may be a sign of immune system cancer, especially in older age groups, because fever in children is rarely found relatable to any cancer activity in the body. Number 6. Oral and thoracic changes. These changes sometimes indicate various oral, abdominal, or lymphatic cancers. Oral and thoracic changes are susceptible in those patients who have a recent history of smoking or drinking heavily. Signs and symptoms include trouble swallowing for more than 2 weeks, chronic dry coughing and sputum production, blood in cough or saliva, sores and painful blisters, and lesions in the mouth and throat that produce heavy, stinky secretions accompanied by blood can be a clear sign of warning that something is going wrong in your body. Run quickly for a screening test and diagnose the problem as early as possible. All these signs may indicate the presence of lung cancer, which is the second deadliest cancer of all. Number 5. Unexplained weight loss. When cancer prevails in the body, the cancerous cells attack the normal ones, and in response to this mysterious activity, our body metabolizes abnormally, resulting in sudden weight loss that is not backed by any diet, workout, or fitness goal. The biggest clue, in this sense, is that it is very random. Maybe a person checks his weight after a span of 10 days and finds himself 10 pounds lighter than before for no reason at all. That's the time when you've got to see a doctor. According to the report by the American Cancer Society, the majority of people lose 10 pounds or more unexpectedly before their cancer diagnosis, because it is one of the early signs of cancer. However, not to say this, but weight loss can be in other diseases as well. You need to see a doctor if you're losing random pounds and kilos. Number 4. Drastic skin changes. Cancers are followed by certain skin changes on the sites of moles, wounds, scars, or blisters, and can be a clear warning sign for its onset and can be easily checked. To check the suspicion of cancer on the wound site, you can follow some simple steps. Check the asymmetry. If one half of a mole or wound looks different than the other, it's a suspect. Check the border. If the edges are irregular or blurred, it's a suspect. Check the color. Cancer spots have varied, inconsistent blue, black, and brown color that abnormally changes every few days. Note that, and if it happens, it's a suspect. Check if it's evolving. If the mole, wound, scar, or any other mark grows in size and bleeds abnormally, then it's a suspect. Check the size. If the size increases more than the size of the eraser in less than a week, then it's a suspect. Number 3. Lumps and bruises. One of the initial signs of cancer is the appearance of unexplained lumps and bruises on the skin suddenly. In the early stages of cancer, it is rarely seen that lymph nodes swell from nowhere to sometimes extremes and indicate malignancy. Not to say this, but they usually swell in case of any bacterial or viral infection due to a cold sometimes. But if everything is normal and your lymph nodes swell, then it's good to consult your doctor. Similarly, bruises like burn marks or blisters appear suddenly on the skin and spread over the body in a week or more in case of various blood and skin cancers. Again, the doctor will decide if the suspect is worth it or not. Number 2. Breast alterations. Breast cancer is the 5th leading cause of death all over the world, and the best treatment for it is early diagnosis. In 2020, about 685,000 women died due to breast cancer. It is popular in females due to glandular breasts, but it also occurs in males of later ages. However, it is not that dangerous as compared to the female group. For breast cancer awareness, an expert from the World Health Organization said it all starts from the breasts. Take care of your breast and the side areas. Check out for the lumps, discoloring, scars, or an abnormal discharge that you might not have experienced before. Rush to the doctor to get the problem diagnosed as early as possible. Even under normal conditions, all age groups of females should go for an annual breast checkup to avoid any consequences that may damage their life later on. Now for number 1, which is unusual blood loss. Some cancers cause abnormal bleeding, which gives a clear sign of malignancy. Malignancy is the onset of malign tumors in the body, like bloody abnormal stools accompanied by severe constipation or diarrhea can be a sign of colon or rectal cancer. The blood can be red or black in some cases. Similarly, bloody urine might be a signal of cancer in the urinary, bladder, prostate, kidneys, etc. in males. Again, there can be several possibilities of other diseases, and the doctor will decide the rest. You just need to report on the symptoms to avoid later consequences. However, bleeding in females is quite technical, like postmenopausal bleeding can have several reasons, but if it persists, the doctor might refer you to a cancer surveillance test. Do you have any symptoms explained above? If yes, then quickly rush to the doctor without panicking. If you're all safe, then share this video to help others. Also, like the video and subscribe to the channel, because it helps us to upload useful content like this. Do share your thoughts in the comments. If you've got any suggestions for us, then we will love to hear that as well. With that said, stay safe, and we'll catch you in the next video.